This is Chelsea Lovejoy doing dynamic cardiology mega code. So your patient is said to be unconscious, unresponsive, and not breathing.
Okay. So BSI, seen safe. What do I see when I walk into the room?
You see a 65-year-old male supine on the floor, unconscious, unresponsive, not breathing, and no citizen CPR.
All right. What are my resources?
Resources are your partner and an engine company.
Is my partner a paramedic or an EMT?
EMT.
Okay. So I would immediately have two of the EMTs starting compressions and taking over and bagging this patient. Does this patient take an oral airway?
Yes.
All right. I would have the third EMT putting the paddles onto this patient and the patches, the patches onto this patient so that I can analyze the rhythm.
And your first rhythm is?
So first rhythm is VFib. So I am going to have everybody clear the patient. I'm going to shock at 200 joules. So I'm going to charge the machine. Everybody clear. I'm clear. You're all clear. We're all clear. Shock. Shock delivered. Have them go ahead and resume CPR immediately. At this point, I'm going to start an IV on this patient. Is my IV successful?
Yep.
All right, I'm going to administer my first dose of 1 milligram of epinephrine, 1 to 10,000 solution per rapid IV push. Once that is delivered, 2 minutes are up. Time for another rhythm check.
Okay, and it's still VF.
Okay. At this point, I'm going to administer 300 milligrams of amiodarone, rapid IV push. Once that is delivered, I'm also going to assess the patient's airway by placing an ETT tube into the patient. I'm doing this by, I insert my laryngoscope blade into the patient's right side of the mouth, sweeping the tongue to the left and pulling the mandible forward. Do I have a good view of the cords?
Yes, you do. It's a grade 4.
Okay, so I'm going to go ahead and pass a 7.0 tube through this patient with direct visualization through the cords. Tube is in. I'm going to take out my laryngoscope, the stylet, and inflate 7 to 10 cc's of air into my cuff tube. I'm going to put on capnography and also my bag valve mask and have the EMT start breathing for the patient. At this point, I'm going to listen to lung sounds and over the epigastrum. Do I have a good tube?
Yep, there's no air in the belly, and you have equal and symmetrical breath sounds on both sides.
All right. So at this point, I'm going to go ahead and secure my tube with the ET tube secure holder. Tube is secure. At this point, we've done 2 minutes of CPR. It's time for a rhythm check.
Okay. And when you look over at the rhythm, you notice that your rhythm has changed to this rhythm.
All right. The rhythm looks organized. I'm going to check a pulse. Do I have a pulse?
You have no pulse.
No pulse, so we are in PEA. So I'm going to go ahead and have my EMTs continue CPR at this time. It is also time for another epinephrine. So I'm going to administer another milligram of epinephrine, 1 to 10,000 solution, IV push. I'm also going to look at treating my reversible causes, which are my H's and T's. H's and T's are hypoxia, hydrogen ion, hypovolemia, hypo and hyperthermia, hypo and hyperkalemia, and hypo and hyperglycemia. My T's are trauma, toxins, tamponade, and thrombosis, both coronary and pulmonary.
Pick one of the H's and fix it.
So one of my H's could be hypoxia. We're going to fix that by bagging the patient and also by monitoring capnography to make sure to keep our CO2 between 35 and 45.
Okay. All right. So 2 minutes are up now,
Time for a rhythm check.
and we evaluate the rhythm, and the rhythm switches to this rhythm.
So this is sinus bradycardia. It is organized. Do I have a pulse?
Yes, you do.
I do have a pulse. So at this point, I'm not going to resume CPR. I am going to have my EMT get a blood pressure for me and also run a 12-lead EKG for post-resuscitation. I am going to package this patient and get ready for transport to the hospital. What are my vitals?
Yeah, blood pressure of 80/60 and a heart rate of 34.
All right, so I am going to go ahead and open up my bag wide open to give this gentleman a fluid bolus of 250 cc's, listening to lung sounds before and after, making sure that the patient has clear lungs. For the rhythm, has it increased at all, or is it still at 34?
Still there.
Still at 34, so I'm going to administer